So let's start our class. So today we are going to discuss about a very important topic, electrocardiogram. So from this topic, you can expect both MCQs and image-based questions. So let's start the class. If you have any doubts in between, you can put it in the chat box and we will discuss it after the end of the class. Okay. So let's start. So first, what is electrocardiogram? The electrocardiogram is a composite recording of all the action potentials produced by the nodes and cells of the myocardium. Each waves or segments of the ECG corresponds to a certain cardiac electrical cycle. So in ECG, what is happening? Each events happening during the cardiac electrical cycle or in the cardiac conduction system is recorded as different waves and segments. So we will discuss in this session about how these waves and segments are formed according to the cardiac conduction system, and how the limbs and the leads are placed. Everything we will be discussing, and we will also discuss how to interpret the ECG. Okay, so we are moving on. So this is in this image you can see a triangle. This image is about limb lead placement. Okay, so in this you can see a triangle here. So this is about the limb lead placement where you can see AVR, AVL and AVF. These three are unipolar electrodes. That means these three need only one electrode for monitoring, mostly positive electrode for monitoring. So for AVR, it is the right arm, AVL, it is the left arm, and for AVF, it is the left leg. Okay. So this is about these three. So these three are unipolar electrodes. And you can see lead 1, lead 2, and lead 3 also. Regarding these electrodes or regarding these leads, these are bipolar electrodes. Okay. Lead 1, lead 2, lead 3 are bipolar electrodes. So they need both positive and negative electrodes for monitoring. So in lead 1, it is the right arm to left arm. So this is the triangle. So lead 1, it is the right arm to left arm. And in lead 2, it is the right arm to left leg. And in lead 3, it is the left arm to left leg. Okay. So this is the triangle. So what this triangle is known as? This is known as Intervents Triangle. Okay. So this triangle is known as Intervents Triangle, which explains how four leads is changing to 6. So this Intervents Triangle explains how these 4 frontal leads is changing to 6 leads. That is, for ECG, it is known as 12-lead ECG, but during clinical practice, you can observe that only 10 leads are present. So with the help of this Intervents Triangle, we can explain how this how we are calling it as a 12-lead ECG. Okay, so this is about the limb lead placement while doing ECG. So if the ECG we are doing for 24 hours, if we are monitoring ECG for 24 hours, it is known as what? It is known as Holter monitoring. So this you should remember, 24 hours ECG monitoring is known as Holter monitoring. Okay, so next we are moving on to chest leads placement. So in 12-lead ECG, what are the leads? Standard limb leads are 3. We already said these are bipolar, L1, L2, L3. Augmented limb leads are 3, AVR, AVL, AVF. These are unipolar. Chest leads are 6. As you know, it is V1 to V6. Okay. So chest lead placement. For V1, it is the 4th intercostal space in the right sternal border. V2, it is the 4th intercostal space, left sternal border. And V3, it is the midway between leads V2 and V4. V4, it is the 5th intercostal space, mid-clavicular line. V5, fifth intercostal space, anterior axillary line. And in V6 is the fifth intercostal space, mid axillary line. So we will see it in the image so that it will be more clear. So here you can see the V1. So you can assess the position with the help of this angle of U Lewis. You can observe it here, the second intercostal space. So in V1 and V2 will be placed in the fourth intercostal space. You can see it in the right and left side. Then V3 you can see. So V3 will be midway between this V2 and V4. And here you can see a imaginary line towards this. So this, it is from the middle of the clavicle. So this is known as mid-clavicular line. In the mid-clavicular line, fifth intercostal space, this V4 is placed. Then here you can see the anterior axillary line. This is also an imaginary line. So in anterior axillary line, fifth intercostal space, V5 is placed. And here you can see mid-axillary line. Here, fifth intercostal space, V6 will be placed. So in this way, the chest leads will be placed. So next we are moving on to ECG grid. So this means the paper in which the ECG is recorded. So you all know about this ECG grid. So this contains small as well as large boxes in it. Okay. So you should know about the measurements, what all are, what is the significance of these small and large boxes, so that it will help you in interpretation of the ECG. So this is a large box. So inside that you can see small boxes also. So regarding this large box, you should know that horizontally the time will be recorded. So time we will assess horizontally, and vertically voltage we will assess. Okay. So in a large box, the time is 0.20 seconds and the voltage is 0.5 MV, and height is also recorded, that is 5 mm, because in this large box 5 small boxes will be there. So you can see a small box here in which the time is recorded as 0.04 seconds, voltage is 0.1 MV, and it is of 1 mm in length. Okay, so this you should have an idea, because while interpretation of the ECG, each waveforms are having its own length and the time period also. So for good interpretation, we should know about the time periods. Okay, so next we are moving on to the waves and segments. So here you can see a normal ECG, which is composed of normal waves and segments. So this is the most important part which should be assessed in an ECG. So let's move on to that section. So before knowing about these different waves and segments, we should have an idea about the cardiac conduction system, so that according to those events only the waves will be recorded in this ECG, in the ECG. So in cardiac conduction system, so this is the image. So in this you can see, while explaining, the first thing in the cardiac conduction system is the sinoatrial node. What is the sinoatrial node? This is known as natural pacemaker of heart. Okay, so from here the heartbeat will get started, or the electrical impulse gets started from the sinoatrial node, and it will spread to where? It will spread to right and left atria. Okay, so when the atria is filled with blood, the sinoatrial node fires, and the electrical impulse will get transferred to right as well as left atria. Okay, so it will make the atria to contract, or atrial depolarization will be happening at this time. And then what will happen? From the sinoatrial node, the impulse travels to the AV node. Okay, so this time period, when the electrical impulse is traveling from sinoatrial node to AV node, this time period in the ECG it is recorded as PQ segment. Okay, so then the impulse reached the atrioventricular node, which is located in the other side of the atria near the atrioventricular valve. You can see it in the image. So this atrioventricular node is acting as an electrical gateway, because it allows the electrical impulses traveling to the ventricles. So it ensures that whether all the blood is ejected out from the atria before the ventricles contract. Okay, so from atrioventricular node, then the impulses travels downwards towards the bundle of His. Then the bundle of His is here. You can see it is dividing to left and right bundle branch. Okay, so then from that the impulse is traveling downwards towards the apex of the heart, and then it is traveling upward towards the Purkinje fibers. Okay, so this is happening in cardiac conduction system. I think you are clear about it. Next, we will see how each ECG waves are formed according to this cardiac conduction system. Okay, so you know the waves in ECG are P wave, you can see in the image, then the QRS complex. So PQ segment is this one. Then in QRS complex, you can see, then the T wave also it's present. So sometimes U wave can also be there. Okay, so this is about the waveform. So let's discuss each waves in details. When it will appear, everything we will discuss. So first one is the P wave. So P wave represents the electrical impulses starting in the sinoatrial node and spreading throughout the atria. So when P wave will be formed, I already said that when the atria is filled with blood, the sinoatrial node fires. So then the electrical impulse will be traveling to both the atria, making it to contract. So that is known as atrial depolarization. And during this time, the P wave is formed. This wave is formed at the time of atrial depolarization. So in this time, what will be happening? Atrial contraction will be happening. That means the atria will eject out the blood to the ventricles. Okay, so normally it is 2.5 mm or less in height. The P wave is 2.5 mm or less in height. Duration is 0.06 to 0.12 seconds. Okay, so this is about the P wave. So with the help of the Ecg Grid and its measurement, you have to analyze the height, the length, and the time of each wave. Next is the QRS complex. So as said, QRS complex represents ventricular depolarization. You can see here. The QRS complex is a very big complex, so it represents the ventricular depolarization. So when during this ventricular depolarization, you can see QRS complex composed of 3 waves: Q wave, R wave, S wave. So each wave represents depolarization of the ventricles, but each part of the ventricles will be depolarized during these QRS complex. So in this Q wave, at the time of Q wave, the interventricular septum will be depolarized. Okay. During Q wave, depolarization of the interventricular septum will be happening. During R wave, depolarization of the whole muscle mass of the ventricles will be happening. So Q, interventricular septum depolarization will be happening. During R wave, whole muscle mass of the ventricles will be depolarized. And during S wave, base of the heart. Depolarization in the base of the heart will be happening during S wave. So these things will be happening during the QRS complex. So each wave is representing depolarization of each part of the ventricles. And here you can see the duration is 0.06 to 0.11 seconds. So Q wave alone will take less than 0.03 seconds. Okay. So this is about the QRS complex. Next is the T wave. Okay. So it represents the ventricular repolarization. Ventricular repolarization means again the ventricle is filled with blood. Okay, so that will be happening in ventricular repolarization. The duration is 0.16 seconds. Okay, So here you can see different abnormalities of the T wave. So here it is the inverted T wave. So in inverted T wave as well as inverted T wave also you can observe during coronary ischemia. Then tall T waves. So next is the tall T waves or peaked T waves. Peaked T waves will be present in an electrolyte imbalance, that is hyperkalemia. Hyperkalemia means increased level of potassium in the blood. So in this time, tall T waves or peaked T waves will appear. Okay, so these are the other abnormalities of the T wave. You can observe it in the images. So this is one of the major point. The tall T waves or peaked T waves will be present during hyperkalemia. So then we are moving on to the U wave. So this U wave is mostly won't be present in every ECG. In some conditions it will be present. Let's see what is that. So it represents the repolarization of the Purkinje fibers. So although this wave is rare, it sometimes appears in patients with hypokalemia. So this is an important point. You should note that the U wave is mainly present in hypokalemia, and even in hypertension or some heart disease also U wave can appear. But the major condition in which we can expect U wave is hypokalemia. So you can observe in the image that this U wave is smaller than the P wave also. After T wave, it will be appearing. Okay, so this is about the U wave. So we discussed about different waveforms in the ECG. Here I am summarizing. This is the P wave, which represents atrial depolarization. That means contraction of the atria will be happening. In QRS complex, ventricular depolarization is happening. Contraction of the ventricles will be happening. In T wave, ventricular repolarization is happening. That means the ventricle is again filled with blood. So we can see atrial depolarization, ventricular depolarization and repolarization, but something is missing here. What is missing here? Atrial depolarization we can see, but atrial repolarization is not there, no? So for this atrial repolarization, obviously it is happening. Atria will be filled with blood, then only these things will be happening. But what is the reason behind it? Means during the atrial repolarization, at the same time of this atrial repolarization, ventricular depolarization is also happening. At the same time of atrial repolarization, ventricular depolarization is also happening. So that for this QRS complex will be appearing for showing this ventricular depolarization. So this the signal of this atrial repolarization is obscured by the big QRS complex. Okay, so this is what happening. So atrial repolarization is happening at the same time. That's why the QRS complex will be obscuring the signal. So that's why there are no waves for representing this atrial repolarization. Okay, so this point also you should keep in your mind. So next we are moving on to different intervals and segments in the ECG. So we all discussed about the waveforms. So PR interval, it's measured from the beginning of the P wave to the beginning of the QRS complex. Here you can see from the beginning of the P wave to the beginning of the QRS complex. So the duration is 0.12 to 0.20 seconds. So this PR interval is very important while studying heart block. So you should keep this thing in mind, that the duration of the PR interval is 0.12 to 0.20 seconds. Okay. Then ST segment. So this is also a very important thing in ECG. You have to observe mainly for assessing the myocardial infarction. So it's measured from the end of the QRS complex to the beginning of the T wave. Here you can see this red part. So here, this will be present during, so this is an isoelectric line. You can see that this red line is an isoelectric line. No positive or negative deflections are present in this. So it represents early ventricular repolarization. It should be flat or isoelectric. It is above or below isoelectric line, which may indicate coronary ischemia. So here you can see the J point. This is the J point. It is marked in the image. So if there is positive or negative deflection in the ST segment is happening, then it will indicate myocardial ischemia. So here you can see the ST elevation. Actually, this area, this ST segment should be in the isoelectric line. It is elevated in this image. And here you can see the ST depression. So one more thing is, while assessing for MI, according to different leads, it will indicate different positions infarction happen. So about that, MI, ECG and all, we will discuss later. This is the QT interval. So regarding QT interval, it is measured from the beginning of the QRS complex to the end of the T wave. In the image, you can observe from the beginning of the QRS complex to the end of the T wave. It represents the total time for both ventricular depolarization and repolarization. And the normal QT interval is 0.32 to 0.40 seconds. Okay, so regarding QT interval, one of the main thing is QT interval. QT interval, with the help of this QT interval, or by assessing this QT interval, we can have an idea about the calcium level. How? Because if the QT interval is prolonged or increased, it will indicate decreased calcium level in blood. If the QT interval is prolonged, it will indicate hypocalcemia or decreased calcium level in blood. And if the QT interval is shortened, a short QT interval is there, it means increased calcium level in blood. Okay, so this is about the QT interval. For while assessing QT interval, if the QT interval is prolonged, it indicates hypocalcemia, decreased calcium level. And if the QT interval is shortened, it means increased calcium level or hypercalcemia. So this is about the QT interval. So here you can see a normal ECG with a normal QT interval, and here is an image with long QT interval. Next, there are some more intervals also. TP interval measured from the end of the T wave to the beginning of the next P wave. Then PP interval measured from the beginning of one P wave to the beginning of the next P wave. It is used to determine atrial rate and rhythm. Next, RR interval measured from the beginning of the QRS complex to the next QRS complex. It is used to determine ventricular rate and rhythm. So these are the other intervals in ECG. So next we are going to discuss about how to interpret or read ECG. Okay, so it is a step-by-step approach. So we discussed about almost all of the components in the ECG, how the limb lead placements, what are the waveforms, and according to which cardiac event these waves are formed. So now we are going to read ECG. So first one is how to determine heart rate in ECG. So mainly I'm discussing three methods. Method one, count the number of R waves in a 6-second strip and multiply by 10. So the rationale behind this is 1 large square is 0.20 seconds, 5 large square is 1 second, 30 large square is equal to 6 seconds. So we are using 6-second strip. So if you are assessing 300 large square, that means 60 seconds or 1 minute. For that, the heart rate can be counted. So we are using a 6-second strip, so that we are multiplying it with 10. So here we can see an ECG. So by seeing itself, we know that it is an irregular ECG. Okay, so in this, for this method is mainly for assessing heart rate in an irregular ECG or with an ECG with irregular rhythm. So you have to count the R waves in it. So you can count the R waves in this ECG, it is about 14 R waves in this ECG. Okay, so 14 R waves are present. 14 R waves are present in the 6-second strip, and we will be multiplying it with 10, so that 140 beats per minute is present. So in this ECG, 14 R waves are present. We are multiplying it with 10, so that the answer is 140. Okay, so 140 is the heart rate of this ECG. So this is a 6-second strip. So this is the method mainly employed for irregular rhythm. Next, method 2, count the number of large squares between two consecutive R waves and divide into 100. So between each R waves, how many large boxes are present? We have to count that. So this is a regular rhythm. So there will be same boxes between each R wave. So we can count that there are 4 large boxes between each R waves. It is same for all waves. So 300 divided by 4. We will be doing 300 divided by number of boxes, large boxes present between each R wave. So it is 75 beats per minute. So this is method 2. Next, method 3. Count the number of small squares between two consecutive R waves and divide into 1500. So this is also for regular ECG, so that between each R waves, the number of boxes will be same. So regarding the small boxes, there are 19 squares between each R waves. 19 small boxes will be present between each R waves. So for easiness, we will be rounding up to 20. So that 1500 divided by 20, that means 75 beats per minute. So by assessing the ECG, we can, with the help of the ECG, we can identify the heart rate also. So these are the 3 methods you should practice whenever you get a chance to interpret the ECG. So next we are going to see how to determine a heart rhythm in ECG. So here you can see a regular rhythm. By seeing itself, we can say it is a regular rhythm. How? Because you can see that each waveforms are in its place only. The P wave is coming, after that the PQ segment, then the QRS complex, then you can see the ST segment, and then the T wave you can see, and the frequency or the interval between each waves are similar similar everywhere. So you can see that, and even the shape and the height, everything is similar in each waves. So it is a regular rhythm. There are some more criteria also we discuss. So here also you can see the P wave and the T wave. We cannot interpret it properly here. And even the QRS complex, the shape is not similar everywhere. So this is an irregular rhythm. So what is a normal sinus rhythm? When we can say that an ECG is following a normal sinus rhythm. That is when the ventricular and atrial rhythm is regular. Ventricular and atrial rate is between 60 to 100 beats per minute. The QRS shape and duration usually will be normal, but it can be regularly abnormal also. Then PR interval is, I already said that the PR interval, the time period is 0.12 to 0.20 seconds. Then P is to QRS ratio. That means for one P wave, how many QRS complex will be present. So for one P wave, one QRS complex will be present. Then regarding P wave, it is normal and consistent in shape. Always before, in front of the QRS complex, it will be present. Okay. So these all things you have to observe, and if all these criteria are present, then we can say that the ECG is following as a normal sinus rhythm. So this is a normal sinus rhythm. Next, we are moving on to sinus dysrhythmias. Okay, so there are sinus bradycardia, sinus tachycardia, and sinus arrhythmia also. So you have to compare the ECG with the normal sinus rhythm criteria. So in sinus bradycardia, what will be there? In sinus bradycardia, there will be decreased heart rate. Okay, decreased heart rate will be there, but all other criteria of normal sinus rhythm will be followed. In sinus tachycardia, there will be increased heart rate. Okay, and in sinus arrhythmia, there will be irregular rhythm, but the heart rate will be normal in this condition in case of sinus arrhythmias. So we will see in detail. Sinus bradycardia, you can see that all the criteria of normal sinus rhythm is following here, but the ventricular and atrial rate will be less than 60 beats per minute. So this is happening in sinus bradycardia. So here you can see the sinus bradycardia. So you can calculate the heart rate using any of those methods so that you can see that the heart rate will be below 60 beats per minute. Then sinus tachycardia. So as already said, all other criteria of a normal sinus rhythm is followed here, but the ventricular and atrial rate will be greater than 100 beats per minute. Then we will call it as sinus tachycardia. So you can see here the ECG is showing a sinus tachycardia. Next is sinus arrhythmia. In this, the ventricular and atrial rhythm will be irregular, but all other criteria, including the heart rate, will be normal, but just the ventricular and atrial rhythm will be irregular. We can see an ECG here. It is showing an irregular rhythm. How we can say that? Because the interval between each waves is not at all similar. So here you can see a large gap between the waves, and here you can see a much shortened gap. So in this way, you have to assess, you have to see the P wave, Q wave, and the frequency of each wave, and the distance between or the time taken for the other waves to come, so that you can see, by seeing itself, you can say that the ECG is following a regular or an irregular rhythm. Okay, so this is about sinus dysrhythmias. It consists of sinus bradycardia, tachycardia, and sinus arrhythmia. Okay, so this is about sinus dysrhythmias. Next, we are moving on to atrial dysrhythmias. So regarding atrial dysrhythmias, mainly three: paroxysmal supraventricular tachycardia, atrial flutter, and atrial fibrillation. So let's see this in detail. So in supraventricular tachycardia, it occurs when a short circuit rhythm develops in the upper chamber of the heart. So here you have to note a thing, that in atrial dysrhythmias, mainly there will be some abnormality or some disturbances with the P wave. Why? Because P wave is representing atrial activity in the ECG. That we already discussed, that P wave is representing the atrial activities in ECG. So in atrial dysrhythmia, there will be some disturbance with this P wave. Okay, so it occurs when a short circuit rhythm develops in the upper chamber of the heart, that is the atria. This results in a regular but rapid heartbeat that starts and stops abruptly. So we can see an ECG here. So in SVT, PSVT, what is happening? Ventricular and atrial rhythm will be regular or slightly irregular, and ventricular atrial rate will be 150 to 220 beats per minute. So tachycardia will be present. QRS shape and duration usually will be normal only. PR interval will be normal. P is to QRS ratio also 1:1. For one P wave, there will be one QRS ratio. Sorry, one QRS complex. Then P wave, it is often hidden in the preceding T wave. So you can observe this in the ECG too. So as I already said, there will be some disturbance with the P wave. So in PSVT, the P wave will be hidden in the preceding T wave. You can observe this in the given ECG. We cannot distinguish P wave in this ECG, especially in the starting. Okay, so this is about PSVT. So here, this is an ECG showing PSVT. Next is atrial flutter. So this is also one of the atrial dysrhythmia, atrial arrhythmia. So in this, what will be there? The ventricular and atrial rhythm is, the atrial rhythm is regular, ventricular rhythm usually regular, but maybe irregular also, according to the change in AV conduction. And regarding atrial rate, 250 to 400 beats per minute will be there. 250 to 400 beats per minute. Ventricular rate will be 75 to 150 beats per minute. That is also abnormal. The QRS shape and duration usually will be normal only. Then in PR interval, the PR interval cannot be measured at all. PR interval we cannot measure. Why? Because the P is to QRS ratio, normally it should be 1:1. For one P wave, there should be one QRS complex. But here in atrial flutter, the P is to QRS ratio will be 2:1, 3:1, or 4:1. That means 2 P wave can be present for one QRS complex, 3 P wave for one QRS complex. Like this, it can happen. So this is one of the characteristic feature for atrial flutter, and one of the main thing you can observe in atrial flutter, one characteristic feature is the sawtooth shape of the P wave. So I will show you an ECG so you can better understand it. So this is the atrial flutter. So here you can see that the P wave, you can see so many P waves for one QRS complex. Actually, one P wave should come, then one QRS complex. But in this, so many P waves are here. And you can see the characteristic shape of the P wave. It is sawtooth shape. Sawtooth shape is there for the P wave. So this is known as atrial flutter. Okay. Next is an ECG showing atrial flutter. Here you can see, especially here down the second one, so you can see that the P wave is forming like sawtooth shape. So this is atrial flutter. Next is atrial fibrillation. So this is a highly abnormal condition or a serious condition. The ventricular or atrial rhythm will be highly irregular. The atrial rate will be 300 to 600 beats per minute. It's a life-threatening condition. Ventricular rate will be 120 to 200 beats per minute. QRS shape and duration usually will be normal, but can be abnormal also. The PR interval we cannot measure, and P is to QRS ratio, that is P wave, we cannot count. So many P waves will be there for, and in between one QRS complex can come. So like that, it will be happening. So regarding all atrial arrhythmias, the P wave will have abnormalities. That is the P wave. In atrial fibrillation also, there will be absence of the P waves. That is, discrete P waves won't be present. Instead, there are numerous small, irregular fibrillatory waves will be present. This indicates that the atria is not contracting properly. It is not, the contraction and relaxation of the atria is not happening properly. Just it is fibrillating. So some fibrillatory waves will be present. The characteristic, the normal shape of the P waves won't be present. So the absence of the P wave will be present in atrial fibrillation. So this is an ECG showing atrial fibrillation. So here you can see that the P waves here, it is not in the normal shape. So, and there are numerous small irregular waves you can see here. So these are known as fibrillatory waves, which is present in atrial fibrillation, but QRS complex is present, and many is to 1. P is to QRS ratio is many is to 1. You can see here. So this is a ECG showing atrial fibrillation. Okay. So this is an ECG showing atrial fibrillation again. So you can see that the fibrillatory waves present here, and absence of P wave is present in this in atrial fibrillation. Okay. So we discussed about sinus dysrhythmias, regarding in MI what will be the changes, in atrial arrhythmias what will be the changes. So now let's discuss how this how we can interpret the ECG. So I will show you some ECG. So try to interpret that. You can put your answers in the chat box. So see this ECG. So see this ECG. Can you say which type of what type of ECG is this? Or you can identify any abnormalities in this ECG? Can anyone say? You have to see the rate, the rhythm, and the P wave, QRS complex, everything you can see. Can you identify any abnormality in it? Or is this a normal rhythm? Or it is a normal ECG? So here you can see that the P wave, there is not one P wave for one QRS complex. Here you can see so many P waves, one for one QRS complex. And the P wave is having characteristic sawtooth shape. So this is atrial flutter. The ECG is showing atrial flutter. Okay. So this is about this ECG. So next ECG. Can anyone say what this ECG is showing? So while interpretation of the ECG, you have to see, I already said, the waveforms you have to observe and the frequency or the distance or the interval between each waves. So first, it won't be so easy. You have to practice it many times. You have to go through the notes, then only you can solve these types of image-based questions. So this is common in most of the competitive exams. You can expect these types of image-based questions to interpret ECG and all. So in this, it is following a sinus arrhythmia. How can we say that this is a sinus arrhythmia? Here you can see that normally P wave is present, QRS complex, the segment, ST segment is normal, then the T wave is also present. So all the waves are present. And even the heart rate is also normal here. But what is the thing happening here is the distance between the waves. So it is different between each waves. Here it is shortened, here it is long. So it is following all other criteria except the rhythm. So it is the sinus arrhythmia. So this is another ECG. So here also you can observe some abnormality. Especially here in the V2, you can see ST elevation here. So after the QRS complex, we have to observe the ST segment. So this is elevated here. You can see here clearly that ST elevation is present. Okay. So this is an ST elevation. Mostly it is representing myocardial ischemia. So this one you can interpret easily. So this is a normal sinus rhythm. You can say that because the rhythm is normal, the frequency or the interval between each waves are normal. All the waves are present, P wave, QRS complex, the intervals are the same and everything is there. So this is a normal sinus rhythm. This is atrial fibrillation as we already discussed. So how we can say that this is atrial fibrillation? The P wave, the discrete P wave is not present here. So before each QRS complex, you can see the P wave is not adequately present, and you can even say so many P waves here. And here also in AVL, you can see the fibrillatory waves are present. In any of the areas, you cannot find a proper P wave here. So absence of P wave will be present and fibrillatory waves will be present before the QRS complex, and it will be small and irregular. So this is a atrial fibrillation. So this class was about how we can interpret the ECG. what all are the arrhythmias. There are some more arrhythmias also. In atrial arrhythmias we discussed, ventricular arrhythmias, and even AV blocks, the MI, everything we will be discussing in upcoming classes. So in this one, we just gone through the basics of the ECG, how to interpret heart rate in the ECG, what about the limb lead placements and chest leads placement, how it will be, then heart rate, how we can calculate, and how these ECGs can be interpreted. So these all things we discussed. So these all things we discussed. If you have any doubts, you can ask. Otherwise, we can end the session. Because regarding this ECG, it cannot be, it is not at all a theoretical thing. There are some theories, but you have to practice with the ECG so that you can identify the abnormalities. So I think no questions in the chat box. So let's end the session. Thank you all. So let's meet in on the other class so that we will discuss other arrhythmias, and in more detail we will be discussing more about the arrhythmias and more about ECGs, how we will be interpreting. And I request you people to practice how to interpret all of these ECGs, how to, whether you can identify each waves or not. So if you have any doubts, then you can you can ask in the other classes also, which will be followed. Okay, all. Thank you.